Today we have Avery, who is a student nurse, counseling a 16-year-old male named Troy. The client has been having a difficult time, feeling like he has very few friends, is always disappointing the people he loves, and just wants to give up. This client was admitted tonight into the ER of Stony Rapids Hospital for severe suicidal ideation. Counseling is an essential part of nursing because it supports patients' emotional, psychological, and social well-being, in addition to their physical health. It allows nurses to provide holistic care by addressing the whole person, not just their illness. Through counseling, nurses offer empathy and emotional support, helping patients express feelings of fear, anxiety, or hopelessness in a safe environment. This builds trust and strengthens the nurse-patient relationship, leading to improved cooperation and better health outcomes. Counseling also enables nurses to identify early signs of mental health concerns, empower patients with healthy coping strategies, and provide guidance for family coping with stress or loss. Overall, counseling helps nurses promote healing, hope, and resilience, making it a vital component of compassionate, patient-centered care. In this counseling session, Avery is going to use both person-centered therapy and cognitive behavioral therapy approaches. She also uses communication skills such as clarification, active listening, Socratic questions, empathy, validation, and reframing.
Hi Troy, my name is Avery, and I'll be your nurse. I'm glad you agreed to talk with me today. How have you been feeling recently?
Honestly, I just haven't been okay at all. I just don't see the point anymore.
That sounds like something very hard to go through. Have you been feeling like life doesn't mean much?
Yeah, exactly. I just feel like with everything going on, it's just been too much for me to handle.
Well, thank you for sharing that with me. It takes a lot of courage to open up about such difficult feelings. So I appreciate you coming in to talk today.
In this initial conversation, some communication skills that were displayed were clarification and active listening. Clarification is important in this type of conversation because it allows the nurse to truly understand what this patient is feeling. It assesses how high the risk of suicide is and can help the nurse decide how to approach this scenario by asking, have you been feeling like life doesn't have much meaning? The nurse is clarifying this patient's feelings and views on their current situation. Active listening was used as well in this conversation. The nurse used nonverbal cues to show they were listening, such as nodding, leading in, and maintaining eye contact. She showed that she understood the patient by asking meaningful questions and paraphrasing to confirm understanding.
Can you tell me about what you've been going through and what's been going through your mind lately?
I don't know, I just feel like I've been thinking that everyone in my life would just be better off without me. And I feel like I can't handle the pressure of my life anymore.
It sounds like you're overwhelmed and maybe feeling like a burden. Can you think of anything that has been going on that is making you feel this way?
Yeah, I don't know, it just feels like everything in my life is just going wrong. Sometimes I feel like I never really fit in anywhere. High school's been pretty tough. I feel like I'm always the quiet one in the back of the class. I'm the person that people always forget to invite or even notice, really. I try hard to act like it doesn't bother me, but it really does. I always see other people like laughing and like hanging out with their friends without me, and I can't help but wonder if there's something wrong with me. I've had a few relationships, but they never last. I feel like I always end up caring more about the other person than they do for me, and they always leave. And when they do, I feel like it just reinforces this feeling that I'm not really good enough for anyone, or like really worth staying for. And it's hard to trust people and really hard to open up. And I feel like when I do, I always just end up getting hurt. And there are people I can talk to at school, but it just doesn't feel real. Like I feel like if I stop showing up, like no one would really notice. And I feel like most days I always just keep these feelings bottled up because I don't want to be a burden. But honestly, just recently, it's just been getting really, really hard to deal and manage with. And it just feels like I'm pretending to be fine when I'm not. And I feel like I'm always like a failure.
It sounds like you're feeling hopeless about the future. That makes a lot of sense given how heavy things are right now.
Yeah, I guess so.
Sometimes when people are feeling hopeless, they have thoughts of ending their life. How have you ever felt this way?
I mean, yeah, I've thought about it a few times.
Thank you for telling me that. It's important that we talk about this kind of things. Are you thinking about acting on these thoughts right now?
Not right now, but I feel like sometimes I just want to disappear.
I can't imagine how that must feel. When those thoughts come, what usually triggers them, and what's happening around that time?
I usually feel like whenever I mess something up at school, or having a fight with my parents, or just feel lonely, I feel like those are my triggers. I feel like I'm just letting everyone down, and I feel like they'd just be way better off without me.
That's really helpful to notice that there are things that trigger these types of thoughts. By talking about these feelings, you are showing a lot of strength and resilience. It sounds like your thoughts in those moments like I'm a failure or I can't do anything right can make things feel unbearable.
Yeah, I really do think that all the time.
In this conversation, the nurse began to use the person-centered therapy approach. Person-centered therapy is a humanistic approach to counseling that focuses on the client's subjective experiences and personal idea of growth. This creates a client as the expert dynamic, which allows the patient to have self-directed growth and build a therapeutic relationship with the counselor. The nurse guided the client to dive deeper into the causes of their thoughts, while the patient still had control over the conversation and gave their subjective perspective on their experiences. Some communication skills that were used in this scenario were Socratic questions and empathy. Socratic questions were used by asking open-ended questions, which will uncover assumptions and provoke thoughts. This is very important in person-centered therapy. Empathy was used in this conversation by saying things like, "That must be very difficult for you to go through," and "You are showing a lot of strength and resilience." By asking this type of question, the nurse is showing an ability to understand the client's feelings, which will make them feel more comfortable to open up.
Let's try something together. You mentioned how often you think I'm letting everyone down. Can we look at that thought a little closer?
Sure.
What evidence do you think there is to support the idea that you're letting everyone down?
I mean, I make mistakes a lot, and I say the wrong thing.
Can you think of any evidence that shows that you aren't letting everyone down?
Well, I guess my parents say they're proud of me, and also when my sister's having a hard time, she says I'm the only one that she can go to.
That's really important. It shows you have value and compassion, qualities that don't fit the word failure. Maybe the thought could shift to something like, I'm struggling right now, but I've also helped people and done good things. How does that feel to say?
Actually, it feels pretty good.
I'm so happy to hear that. By challenging these negative thoughts, we can change the way we feel. Let's think of what you can do when those hopeless feelings come again. What might help ground you or remind you that you're not alone?
I think I could call my sister, or maybe write down things that I've done right before.
Yeah, those are excellent ideas. I'll also connect you with our crisis counselor and make sure you have the 24/7 crisis number. Together, we can keep you safe and work on building more of those helpful, hopeful thoughts.
In this conversation, the nurse used the cognitive behavioral therapy approach. Cognitive behavioral therapy is based on the idea that thoughts influence emotions, behaviors, and actions. This helps identify key stressors and coping mechanisms used already by the patient, and how we can help them adjust these in a more positive way. By helping the patient recognize some good qualities about themselves and opening up with positive ways to change their thoughts, it may help the patient get into a habit of restructuring the way they think and prevent a spiral. Some communication skills that were used in this scenario were reframing and validation. Reframing was used to change the patient's perspective on a situation by trying to find a more positive interpretation. By saying, "It shows you have value and compassion, qualities that don't fit the word failure." When the patient described that her sister said he was the only person she could talk to, this displayed reframing. Instead of thinking everyone in his life is disappointed in him, maybe think about the ways that he has been a positive influence and a good person. This can make the whole picture seem better. Validation was also used in this scenario as well to help the client feel heard, seen, and supported. When the nurse said, "That must be very hard," this helped to build a more trusting nurse-patient relationship. When a patient isn't feeling like they are fighting for their point of view to be heard, They will be more open to suggestions for interventions, as well as being more comfortable to open up about difficult topics.
I really appreciate how open you've been today. You've shared a lot about how things have been, feeling disconnected, hurt in relationships, and unsure about where you fit in. That takes a lot of courage.
Yeah, I mean, it's not easy to talk about, but it feels kind of good to get it all out.
I'm really glad to hear that. Talking about these feelings is the first step towards changing how they affect you. You've already started to challenge some of those painful thoughts, like believing you're not good enough or that no one would notice if you were here. The truth is, those things are shaped by pain, not by who you really are. You've shown compassion, awareness, and a real desire to understand yourself better today. Those are signs of strength, not weakness.
I mean, I don't really usually think about it that way, but maybe you're right.
I think you're beginning to see that your feelings make sense. They come from real experiences, not from something being wrong with you. And with support, you can start to rewrite some of those patterns. The things you've gone through in high school, in friendships and relationships, they've left marks, but they don't have to define your future.
I mean, I like to believe that. I just don't know where to start.
That's okay. We'll take it one step at a time. Today, we've already started by identifying some of those thoughts that make you feel worse and finding small ways to challenge them. For now, we'll focus on keeping you safe and supported. Let's make sure you have a safety plan in place, who you can reach out to, what helps you cope, and when to get professional help.
Okay, well, I can talk to my sister, and maybe I'll try writing things down when I start to spiral.
Yeah, those are great steps. I'll also connect you with our mental health counselor and make sure you have the crisis line saved in your phone. You're not alone in this. The feelings might come and go, but so will moments of relief and hope, and we'll build on those together.
Thank you. I didn't think anyone would actually listen to me like this.
You deserve to be heard, and you deserve support. I'm really proud of the way you've shared today. Remember, healing takes time, but it is possible. You've already taken a big step by being here and opening up. Let's keep building from here. You don't have to face it all on your own.
Through this counseling experience, we learned the importance of truly listening and creating a safe, non-judgmental space for patients to share their feelings. Using a person-centered approach helped us build trust and show genuine empathy, which encouraged the patient to open up about their struggles and suicidal thoughts. Transitioning into cognitive behavioral therapy allowed us to help the patient identify and challenge negative thought patterns, fostering a sense of hope and self-worth. I realized that even small amounts of understanding can make a meaningful difference to someone in crisis. This experience reinforced that counseling is not just about giving advice, but about being present, compassionate, and supportive, helping patients find their own strength and reasons to keep going. It also reminded us of the vital role nurses play in recognizing emotional distress and connecting patients to the right resources for ongoing mental health support.